The ImproveWell app, one of the ways of us getting frontline feedback from staff is using an app. It's difficult because we can't go into an infected area just to get improvement ideas. I wouldn't put anyone at risk for that. I mean, QI is important, but not that important to take a risk. So we're using this app, which is available to anyone who has any email address, not just NHS, and we're promoting it to anyone who's working in Dragon's Heart. The idea of the app is that they can feed back ideas that they have based on their environment, on their working experience, on what's missing, what could be done better. And they can feed it back in real time, or they can do it when they're reflecting after their shift or in their downtime. And it's very easy, user-friendly. It's just like a text message. We try and respond as soon as we can, but certainly within the same day. We may not have the answer instantly, but we certainly know who to ask. So we'll say we've escalated it to maybe workforce, or we've taken it to the operations team, or whatever. And then we feed back to the individual user about what the result of their improvement idea is. And in addition to that, we can feed back to everybody on the app if we want to, and say this is a summary of what we've done this week as a result of your feedback. Or we can do it to specific groups of users. Say we want to talk to the caterers or the porters, or we want to talk to the nurses. And so we can choose how we feed back that information. So the idea is, one of the good things about quality improvement, if you do it well, is you don't have top-down diktats unless you have to, unless it's something that's critical. You would ask the users to inform what needs to change at a simple level, and then we would take their ideas and make things better. So it's bottom up as well as a little bit of top down, and maybe you get the best of improvement by doing a bit of both. Those who are engaged in it, we've had some great ideas. I mean, ranging from could we do more recycling in the canteen with the cutlery, through to I'm concerned about the social distancing in certain areas, through to things about the ward environment. Someone suggested that it would be nice to have a clock for the patients to see, be more orientated in time and place. That would be, because it can be disorientating particularly if you move between wards. Simple things like that, At the moment, they're not complex ideas. That may come later when everyone gets used to the environment, but at the moment they're very simple ideas, but they are things that maybe haven't been considered. So they're really important. So the app is called ImproveWell. They can either just download the app on their phone, or they can do it through the links that are up in the safe haven and all the staff areas. And once they're on the app, they literally just are asked, have you got an improvement idea? What is it? And they tell us. There's also a good day, bad day measure, which is trying to look at joy in work. And if they are having a good day, they're invited to tell us why. And if it's not such a good day, they're invited to tell us why.